I wanted to make a quick introduction before we get started. So Dr. Philip Smith, he completed his PhD training at the University of Cape Town, South Africa. And after completing a master's degree in psychology, Dr. Smith's PhD explored the impact of behavioral economics design in tailoring on the acceptability and uptake of sexual health services in adolescents and young adults. Dr. Smith was a GloCal Fellow in 2021-2022 year. His postdoctoral research explored the improving HIV testing through the U is equal to U, undetectable equals untransmittable messaging, as well as exploring men's HIV prevention needs in high HIV prevalence communities in South Africa. Dr. Smith is currently a senior scientist at the Desmond Tutu Health Foundation and senior lecturer at the Health Sciences Faculty and University of Cape Town. Dr. Smith's K43 research is using behavior economics to design male-centered sexual health services that support men's health. So it's an honor, privilege, and it's really wonderful to have Dr. Philip Smith here. And we have about an hour, so I'm hoping that we have some time at the end for scholars to ask you some questions. So Dr. Smith, take it away.
Thanks very much, Jay. Thanks. And thank you so much, Christine, Kimberly, Craig, for the invitation to come back. It's really an incredible honor to speak to the GloCal Fellows and about career development and that trajectory. Tell me, can you see my slide? Yes. Okay. All right.
Yes.
All right, so let's get into it. So I'm going to talk a little bit about my career timeline, and I'm going to emphasize out of these four blocks, the education and research piece. Here you can see there's a timeline of my career starting in 2003. I've read out applications for funding over there that were not discussed, not funded. We'll spend a bit of time talking about that later on. So I started my education at the University of Cape Town in 2003, and that gave me a broad base understanding of psychology. And I found that I had a particular affinity with psychodynamic psychology, social psychology, and cognitive psychology. I then went on to do an honors degree at the University of the Western Cape, and UWC, if you know anything about South Africa, was a base for anti-apartheid icons like Jake Scherwel and Desmond Tutu. And the emphasis at the University of the Western Cape was on research and community-based psychology. If you hear dogs breathing loudly, that's because there are dogs breathing loudly in the background. And it was there that I developed sort of the desire to answer the question, why do people do what they do when they do it? And at the time, I sort of had two interests. And the one was the socio-political interest around, really around voting at the time, which was declining, and particularly among young people. But further than that, because of, I suppose, the context of South Africa, tragic events and spaces in history, such as apartheid and other atrocities, and how do people commit acts like that, but also how do other people go along with it? And then on the other hand, there was HIV, which was a component of basically every university course I had studied up until that time. And I found that I had quite an adverse emotional reaction to HIV. I never, ever wanted to study HIV again. And because I was interested in psychoanalytic psychology, I decided to ask, well, why is that? And is what I'm thinking and feeling maybe what others are thinking and feeling? And my thesis was based on othering HIV. And I found that the people that I interviewed at the time othered HIV acquisition risk based on race, religion, sex, and age. And then what I found was that there were influential works. So from Freud and Becker influenced my thinking at the time. From with social psychology, Sigmund Freud, psychoanalytic psychology, and Ernest Becker. And Ernest Becker, his work has been translated into experimental social psychology. A group from Kaczynski, I think, leads the group out on the west coast of the United States, testing the effect of mortality salience on thinking and subsequent behavior. And so my supervisor at the time, because I had a history in qualitative research methods, encouraged me to test some of the ideas that I had with experimental social psychology. And I found in short, that thinking about personal mortality versus dental pain significantly increased vulnerability denial to chronic diseases, but HIV specifically. And so the takeaway from that was that information presentation matters, that information presentation influences motivation versus psychological defense. And so based on that, designing messages around less around death is important and more around drives and desires seems to be one thing that we could do better around HIV. So I decided to pursue those ideas in a PhD with that premise that fear appeals. They don't have no effect, but they have limited effect on our thinking and our behavior. And if we design around desire, such as with behavioral economics, are there opportunities to increase health behavior? And so that's what I explored in my doctoral studies. So maybe you've seen this before, but we often know what's good for us. If you're anything like myself, you make resolutions at the end of the year, beginning of the year, but we find it really difficult to stick to those resolutions. If you're anything like me, you have engaged in overeating, maybe alcohol abuse, sedentary behavior, smoking, and we don't take our medication as prescribed. Many health problems aren't medical, but they're scientific, aren't medical or scientific, but behavioral in nature. Research shows us that about 40% of premature deaths are related to unhealthy behavior, and chronic disease compliance worldwide sits at around 50%. So we know what's good for us, but we have difficulty sticking to our health decisions. And behavioral economics comes in and can explain why motivation often doesn't translate into action. So here are three of the authors in that I've read, but particularly Daniel Kahneman. He and his late colleague Amos Tversky won the economics Nobel Prize for their work. And often when we think about behavioral economics, we think incentives. And while incentives are part of behavioral economics, it really is the design around decision making. So designing the context around which people make decisions. So it's different from conventional economics, and conventional economics assumes that people can think like Albert Einstein and store as much memory as IBM's Big Blue and exercise willpower just like Mahatma Gandhi, but people don't always behave that way. And we don't always behave in our best interest. We have competing priorities, and we weight present benefit far more heavily than we do future benefits. And so behavioral economics studies those systematic mistakes that we make in our decisions and shows us that there are times when we are predictably irrational, and so makes use of those insights. One of the first recorded examples of trying to foil our future selves is the story of Ulysses, where he got his sailors to tie him to the mast because he wanted to hear the song of the sirens, but he didn't want to be drowned by them. So they then plugged their ears, his sailors, and tied him to the mast so that he could achieve that goal and not give in to his temptation. So back to the PhD. What I did was I asked young people, partly because I had heard or read this quotation that young people were sick and tired of hearing about AIDS. And so I asked them, so what do you want from sexual health services? And decided to pilot that. And young people told us that they wanted friendly and convenient services that emphasized health, wellness, and flourishing, as opposed to HIV, death, wasting, as opposed to that. And what we found was that when we took their considerations on board, we designed a couple of interventions, including a mobile clinic for young people. It increased the uptake. And what we saw was that not only were we seeing more young people come and test for HIV, but we saw that young men who were notorious for avoiding services were coming in more frequently than conventional clinic facilities in the same community. That is a picture of me and my PhD supervisor, Professor Becker. So you'll see that that every step built on the last step, which is, I think, quite fortunate. I remember a mentor early on in my career saying that that's important to if you can build your future on your previous success. So based on that PhD research, I took it a little bit further and looked at men and mortality in South Africa. So young men in South Africa have the highest rates of premature mortality worldwide. If you look at premature mortality, that's premature mortality for men under the age of 35. South Africa is the highest, and we double the next country's mortality, which is Russia. And a large part of that risk is HIV acquisition, which is the second leading cause of death for young men. Men in South Africa are less likely to know their HIV status and therefore less likely to be on treatment, less likely to be virally suppressed, and then obviously less likely to survive on treatment. So during my PhD, I met Dr. Andrew Medina Marino. He has a research site out in East London. His specialty is TB research among men. And we got talking about this topic while he visited the Desmond Tutu Health Foundation offices. And those conversations then translated into my postdoctoral research and training. You'll see there that was a dinner that I had with Andrew, and I also enjoy running. So whenever I visit the research site, if it doesn't happen on Strava, it never happened. Go running, and the research question that came out of our conversations was, how are we going to get men in high HIV prevalence locations to prevent HIV? And so the research question for my research was what we offered men PrEP and asked them what would get you onto PrEP and what would get you to sustain PrEP. And that turned into a publication that's already out, but we'll talk more about that in a second. Also, part of the postdoctoral training was a couple of courses in qualitative research methods down at the University of Cape Town, and introduction to I suppose it's an adjacent theory, network individual resource model, which looks at tangible resources and mental resources that facilitate health behavior. That the pictures from left to right over there, two of my mentors, Joseph Daniels on the far left, and Andrew on my on the right of me there. And then we have pictures of the research team. So that second picture on the far left is Kia Cody. She led the fieldwork activities. And then another picture of us at the ward councillor. We applied for permission to do the research in the Eastern Cape, the Buffalo City Metro Municipality. And then the final picture there is of our training session that we conducted before we started the research. That research was presented at the Montreal AIDS 22 conference. So that turned into a poster presentation, and it has been published in PLOS 1. And we have a second paper that looks at sustained use over 6 months, sustained PrEP use. So what I did was I quickly transformed those baseline findings into a K presentation. So one of my GloCal outputs was a K application. So I turned that into a K that was 6 months into the GloCal postdoc year. And before I get into that, this is probably, maybe some of you are thinking about pursuing a K Career Development Award. It's a significant undertaking. If you're in the US, you're a US citizen, there are 3 deadline cycles for the KO1. And if you're outside of the US, there's 1 December deadline. And that has multiple pieces. We'll talk a little bit about that. And broadly, those pieces are, they cover research and training. And it's important to remember the training piece, because that's 50% of what the K proposes. And so you're looking at a topic for your research and skills development that will help you to conduct that research. And then also to think about the roles. You are the PI for your K. You will lead the project from concept to submission. You're responsible for getting that proposal over the line. And then you have your mentor who is going to lead your training and ensure the completion of your K outputs. And just to look at the submission pieces, so this is the list of submission pieces that I had, everything from bio sketches to the specific aims, your budget, and your letters. And so all of those pieces are essential pieces of your K application. Yeah, I'm just wondering if it's useful to ask questions now or later, but I'm comfortable with either. So a little bit about failing forward. So that K application that I submitted had actually been remodeled from an earlier idea. So I had submitted to a UG/UH call for decentralized mail art. And that proposal was not discussed, and then subsequently submitted that proposal for an R01, and that was also not discussed. So research had moved on a little bit from there, and the setting that I was in saw that PrEP could be a useful addition to the mobile clinic that I had worked with previously. So I turned that into the K43 application, which is called Male Access to Sexual Health Services and PrEP. And that application that was submitted in December 2021 was reviewed and then funded in August of 2022. Okay, I see Jay's said you can put your questions in the chat. So the first steps, certainly my experience for the K was to set an upload date 2 weeks before the deadline, and then to schedule weekly progress update meetings with the grants officer or the research officer, or whoever the person is who helps you to upload to the NIH, that you've got to meet regularly with that person to assess your progress. And then also contact the program officer. So even if just, in my case, to get over myself, but to introduce myself to the program officer so that she knows who you are. It's Christine Jessup if you're not in the US. And then also maybe to introduce the research topic, and to then thirdly field, are you on the right track with this, or are you going nowhere? And you might get the response, there's no feedback, or yes, this is wildly popular at the moment as a novel idea. But introduce yourself, start with that, so that they know who you are when your application comes in. And then start with drafting your specific aims with your primary mentor. You're probably going to work on your specific aims. You're probably going to work on this for about 6 months. That's what I've heard is usually the case. And it's the last thing that you will be working on before you submit. And then also seek your approvals and letters of support from your grants team, your research office, your mentors, and your referees. Those are important. So I'll tell you, I asked for those letters way in advance, and I discovered that one day before the time I had not received a reference letter from one of my referees, and I suppose serendipitously, he submitted a couple hours before the deadline, so it didn't all go to plan. But had that not been handed in, that would have been counted as an incomplete application. So get your letters, your approvals before the time, and work backwards. So we've already said start early, set an upload date for before the time, because you're going to get readouts of what's missing, or if there are any errors, and those are very useful before the time, not so useful on the day. Then balance your training and your research for high impact. So often what happens, what I've heard happen, what I've seen is that focus, there's a lot of focus on the research part of the application. And it's so important to realize that this is a training grant. And so 50% of the K is on training. So be precise in your training plan and say exactly what you're going to do, who you want to be at the end of the 5 years, and how the courses that you propose and the people, the mentors that you propose are going to help you to get there. That's a mistake that's often made, that you can prevent by ensuring that training plan is sufficiently substantial, but also not too substantial, because if there's too much proposed, you will get that feedback from your review panel. Then choose expert mentors. I can't tell you how many, but that's something to think about. I have 4 mentors, a primary South African, primary US, and then 2 subject matter experts as well. So I have 4 mentors for my K. And then another thing that I did was that I used successful K applications. So I had, when I wrote the K application, I had 3 successful applications, and 1 application that was not successful. One was a K01, and I had 2 K43s that was successful, and 1 K43 that was not successful. So I could sort of try and gauge what the human being on the other side wanted. And then just on that piece about human beings, use diagrams and tables. So I don't know if you're a bit like me, when you're hit with the wall of text, it's more difficult to digest. But if there are diagrams and tables on every page to help sort of synthesize and digest the information, it's a much better read. It's much more easygoing on the reader. So be aware of that. And then just so that we emphasize the training first, my K training emphasized behavioral economics intervention design with specific courses around that, clinical trials design, quantitative research methods, particularly in men's health, and qualitative and mixed methods research as well. And then back to the research aspect. So I used the behavioral insights that I had gained from my previous work, building step by step, and also a participatory model that I had just before my GloCal postdoc. I had used this with some colleagues, a participatory model to look at phrasing, messaging, for the undetectable equals untransmissible message. That subsequently turned into an R01, which I'm a co-investigator on. And then we use that to prototype message, to prototype a message for HIV testing uptake and linkage to care. So I'm not going to read this entire slide, but this is my K, and it's really around men and HIV mortality in South Africa. Men are willing to engage in HIV services, but services often present obstacles. Frequently, men say that they don't use this language, this is our language, that services are gendered and they're designed for women. And so knowing that men are willing to engage in services, how do we design messaging and services to help prevent HIV acquisition in this population? So I'm going to stop there. Thank you so much for listening, and thank you again for the invitation to speak. And let me know if you have any questions.
Well, Dr. Philip Smith, thank you so much for presenting your work, and I really appreciated all the practical steps and advice you provided in preparing the Career Development Award, and I think it's really useful for our scholars. And thank you for presenting in a very efficient, timely manner. I want to open it up to our colleagues here and ask questions. Don't be shy. Dr. Awirut, do you have a question for Dr. Smith?
Yes. Hello, Dr. Smith. I'm Dr. Virut from Thailand. And my project has some aspect that quite similar to your project as well. I work with gender diverse people in Thailand and doing GloCal research about PrEP and the sexualized drug use, the substance use and their sexual activities in Thailand. And I would like to set up the clinic or even the center that could help these people to engage into sexual health services as well. So the question is, I would like you, I just would like to hear you to share more about the how you setting up the system for provided the resources or the information about sexual health care in your settings, and how important of the role of mobile health intervention, because you mentioned about the involvement of the mobile intervention in this service. Would you please share more about that and give some ideas about that? Thank you.
Yeah. So what I didn't mention, it was I had actually rehearsed part of that in the talk, is your relationships are really important. And so it's important to develop relationships with folk who are going to bat for you. And some of those are around the machinery, which you're talking about. And that exists. And so Linda Gale Becker, my primary supervisor, has a large research machine, which includes the both conventional sort of clinics, but also mobile clinics. And so my encouragement is to develop relationships with folk, and your ideas in partnership with mentors. That's the one thing. The other is develop relationships with people who are going to come out for you guns blazing. So they're going to not just be supportive, but absolutely supportive. People who are going to uh, not just write you wonderful letters, but actually provide you with the resources to complete the research. So that's my experience. I developed these relationships and kept them going through my career. Often that's difficult. I often don't know how to approach folk, and it sounds a little odd, but how do you start a conversation? Maybe that's a good topic for GloCal fellows: how to start a conversation with a potential mentor. And then to sustain those relationships. I hope that's helpful.
Yeah, well, thank you. Any other questions for Dr. Smith? So while we wait, I have a couple of questions. So first off, I thought your advice on the process of preparing the Career Development Award, I think that was very, very helpful. And the topic itself, the idea of using behavior economics. So you initially mentioned that traditionally one of the components of behavior economics approach is using incentives, whether it's a financial incentive or other means of incentive. And I think in the substance use field, they kind of use a similar framework, but they call it like contingency management, where they actually provide incentive for people to, reduce drug use or stop drug use, right? So the question is, for your research in terms of prototyping messaging, I wonder if you can say a little bit more about what type of motivational approaches you are exploring if it's not financial incentive. And in terms of nudging people, I love the word nudge, because I think people, and all they need is a little nudge to get to engaging in a protective behavior. And if you can find that critical component to nudge them to the extra step, it'll be really successful. So yeah, I'm just really interested about the messaging piece.
Yeah. So I think one of the things I said there was design around desire. So it's important to use internal motivations or design around identity. And so what we did, I mentioned really briefly the U equals U messaging piece that I did just before my GloCal award, was we went to men and we said, look, we're having difficulty presenting the U equals U message to men. This is what the U equals U message is. And we talked about viral load. We did all the research, medical language, and we said, this is not going to fly with men. In fact, men have told us this doesn't fly with them. If you had to present this message to your peers, how would you say that? So what we did was we went through 2 days of men pitching the message to one another and to us, and we recorded that. And what we found at the end of the 2 days was that men proposed 3 things. They said, we want you to simplify the message, obviously. The second thing is we want you to redefine the man for whom this is intended. So that we don't want him to be the bad guy. We want him to be the good guy. The good guy who is protecting his sexual partners, he's protecting his family. And then we want you to tell us about the benefits of art. So the idea was to flip the messaging on its head. So often what we do is we say, come for an HIV test. That's hugely threatening. And immediately one of the things that I talked about is you get psychological defenses flare up. That's not me. I'm not that guy. But if we flip it on its head and say you can be the guy that you want to be, and put the identity of the good guy first, we think this is what they told us. We think this message is going to fly in the community. So we did that. And we produced this message that was about 4 minutes long, but that's way too long. And we eventually got that message down to 40 seconds, where we did those three things. We simplified the message, we redefined the guy for whom it is meant for, and we emphasized the benefits. So we flipped the message on its head and said, this is U equals U. And what we found when we did a randomized controlled trial was that we almost doubled the odds of men coming in for an HIV test when we emphasized what men desired. So that's designing the environment in which the decision is made. So we invited men with a U equals U message that took 40 seconds to deliver, or a 10-second message that was just a bland invitation to come for HIV testing. And we found that I'm going to not get this absolutely correct, but 14% of the men in the control condition came in for an HIV test, and 26% of the men in the U equals U condition came in for an HIV test. So that's the sort of understanding of behavioral economics that I used. I sort of tend to like that internal motivation aspect of behavioral economics. Are there ways of getting people internally motivated to achieve something that they want by making the next step in their health behavior journey?
That's great. Yeah, well, thank you for that perspective. It's really, yeah, I mean, I definitely appreciate the process you took. And yeah, I think it's important to really think about how we frame messaging so that participants, men in your case, are motivated to engage in a certain behavior. And I think the U equals U messaging, like the example that you gave, is really important. So yeah, instead of explaining the scientific basis of the U is equal to U, even some colleagues in the US, they work with the participants to really think about what really motivates them. So one of the messaging here is emphasis on the sexual pleasure, emphasis on love, emphasis on protecting your partner. So, the fact that you're positive, but you're undetectable, means that you're protecting the partner and you actually can have loving relationship with your partner. So I think, and that's totally different from, U is equal to U messaging. So yeah, I really appreciate your work, and it's really fascinating.
Yeah. No, that's fascinating. That is. And it connects in a way that, talking about dolutegravir doesn't.
Okay. Any questions for Dr. Philip Smith? We have some time. Your presentation was absolutely crystal clear, so nobody has any questions.
Well, it's either that or it wasn't clear at all.
Any questions?
Is anybody heading towards a K or in the process?
Yeah, I got a quick question.
Yeah, go ahead, Nathan.
This is Nathan. I'm a general surgery resident and a GloCal fellow based in Tanzania now. My question, I agree. I really like the way that you reminded us on the writing a K that it's easy to get swept up in the in looking at kind of the study aspect and the academic aspect and forgetting about the training, which is 50% of the grant. And I was wondering, when you're thinking through how you balanced kind of formal coursework versus informal training through mentorship, and how you kind of framed that into your K in a way that convinced people that this was the training that you needed and that they needed to fund.
Yeah, so I did that in conjunction with my mentors. Great question. And I suppose part of developing the K is to do exactly that, because you will be measured on your proposal and your timelines for your training. So practically what I did was I spoke with Dr. Alison Buttenheim about appropriate training. So because I'm heading towards behavioral economics, my training is around Dan Ariely's Irrational Labs out in the States, and I can access that from where I am. So that's it's an online course. I can access it anytime I want, but it's pretty heavy. And so that is front loaded, along with almost all of my training is front loaded on the grant. So my first year is front loaded with training, and then I move into research activities in the end of the first year, beginning of the second year. And then what you'll be required to do is to a good application has your Gantt chart and your training your training tables specifying when exactly you will be doing this course, where exactly is the course, how long is that course, and what skills are you going to get from attending that coursework. Is that clear enough? Is there?
Yeah, no, that's really helpful. Thank you.
Okay.
Yeah. So just to add to that, I think Nathan, your question is really good, and Philip's presentation on like being very clear on your plan is really critical. So even your mentor interaction, it's good if you have like very specific description. I am going to meet with Dr. So-and-so, every week to discuss the progress. Most of the time, like Philip said, the courses are front loaded, but if you have like different research phases, and say your training goal 3 happens in year 4 or year 3, for example, the final phase of your study, you can actually map out the course that can be taken not in the first year, but it could be in the second year. But the important thing is you need to really have very clear timeline, what mentor interaction will benefit and fill your training gaps, what coursework will prepare you to conduct the proposed activities, and then making sure that the sequence of the training plan makes sense. And I really appreciate the graphical aspect, like whether it's a figure displaying the timeline or how your training gaps and your mentors and the activities are tied together. So I think those are really practical advice.
Yeah. And then also, when you suggest your courses, one of the common mistakes is to suggest a course you think that everybody should have, or you think they want you to have. That's a mistake. It has to fit into. So one of the things they say is, many people say they're going to do an epidemiology course. It's great. It's useful. But you've got to justify why you're going to do this course. And they will pick it up if it doesn't fit into who you say you want to be at the end of the 5 years. So it's important to be very precise about why you're doing the courses that you're doing.
Yeah. I mean, this is really practical and great advice. And I think in terms of coursework, given, our experience with the COVID-19 pandemic in the past 3 years, like typically courses were, you know, like traditional courses where you actually take it in a classroom setting. And I think now there are much more, opportunities for virtual learning. And, whether it's live virtual or asynchronous, like pre-recorded session. So I think there's, in terms of innovative, like creative strategies to fulfill or attend those courses, I think there are much more options. So I think it's important, like Philip said, it's important to identify the courses and convince the reviewer that this is the course that's going to be really critical in, making your pathway to independence. And it doesn't necessarily have to be like a physical like course, and it can be an online or hybrid or virtual.
Yeah. So I think all of my courses are virtual. Some of them are, I think only one is happening physically. One out of the 6 courses that I've proposed happens physically, but I will be attending online. So, and that's partly, as you say, a result of the last couple of years that do that.
All right, this has been a really wonderful session. Any last minute questions, comments, thoughts?
Hi, Philip. Yeah,
Go ahead.
thank you for sharing your experience and for the helpful tips. I was curious to find out how important is it to demonstrate your transition from a K grant to perhaps an R01? Is it important to show that in your grant?
Yes, it's absolutely essential. So they one of the pieces of feedback that I got was on my proposal for what happens next. That's the one thing. The other thing is that, yeah, so you'll want to transition into an R21 or an R34 or an R01. I mean, there might be other perspectives on this tomorrow, but I certainly think it's really important to show what are you going to do with your training and your research after you're done. That's important. But also, I suppose once you're in the K, is to keep that constantly in mind. Where are you heading? What are you using this for? I recently attended a session where they talk about it's so important to have that plan. Because when you have this protected time, just like GloCal, I suppose, it's easy to enjoy the space, and it's a wonderful space to develop both the GloCal, but also the K space. But really, to be mindful of where is this going? It is part of it certainly was part of mine, and I was assessed. I was told that the R01 that I proposed maybe wasn't, I wasn't going to have data that was substantial enough to head there, and I had to respond to that to the reviewer's comments. So yeah, it's important to have that in there. Maybe Jay, you've got a.
Yeah, I think that's a really great advice. Yeah, it's, I think the K, it's essentially like how you tell the most compelling story and convince the reviewers and the funder that you are worth investing in. And I think that translates to, if we invest in this scholar, he or she or they will, advance and go beyond just a K. And have, our grant in the future. And, if you describe, and obviously this is something that you have to anticipate and it's all hypothetical, right? So, but, as long as you're very intentional about what your plans are, how your K is going to build your, qualifications to be ready for a larger study. And I think the specificity is really important. And sometimes it's hard because you haven't done the work yet, but it's more about like those grantsmanship, like how do you tell a really convincing, narrative and incorporate that into the proposal. Yeah, and I think like Philip said, it's really important to be persistent, and I think many career development seminars emphasize that you need to be determined, and don't get discouraged if your first submission does not get discussed. Or I think every action is a learning process, and eventually you'll succeed. So you just have to trust yourself and keep going.
Great.
All right.
Thank you very much.
All right. Well, thank you for your questions. And if there's no more, so this session's going to be recorded. It has been recorded, so you can view it at your future leisure. And I'll give you 5 minutes of your time. So I appreciate all of you, and thank you, Philip, for sharing your work and your time. And we'll see each other again next month.
Thanks very much.